Hello, future nursing officers. Welcome back to our channel FNOs with Aishwarya. Before we start learning different disease conditions, it's very important to understand some basic medical terms that are used again and again in nursing and medical science. Today's video is all about those key terms made super simple for you. Now, let's begin. Main 10 basic medical terms commonly used in disease conditions. First one is a etiology. Etiology means cause of disease. Because of pathogens, bacteria, viruses, disease occurs. And that we called etiology. Means the main cause of disease. For example, TB. TB is main cause because of Mycobacterium tuberculosis. AIDS because of HIV, human immunodeficiency virus. Then the second one is a pathogenesis, means how the disease develops from the primary stage to the secondary, tertiary stage, how disease occurs. In a diabetes patients, lack of insulin. Because of lack of insulin, high blood sugar occurs. And after that, high blood sugar, organ damage, and which is the most severe condition in the patient. We see in a diabetes mellitus patient. Then the incubation period means time from infection to the first symptom. We calculate from the time from infection to the first symptom. When infection occurs, and after that, the first symptoms we see in that patient, which is the incubation period. Like in a measles patient, incubation period is 10 to 14 days. Then the prognosis, expected outcome. After given to the treatment to the patient, what the prognosis happen, what is the expected outcome happens, is the patient condition severely increases, or disease condition uh, rate is decreases. That is prognosis. Then risk factor. Risk factor is a things that increase chances of disease. For example, smoking leads to cancer. In females, the more chances are breast cancer happens because of smoking, which is a risk factor. Then complications. Problems due to disease. What happens? Complications happens because in a hypertension patients, the main complication is stroke. That are complications. Then prevention, stopping disease before it starts. We see in the patients taken vaccinations, immunization. When after childbirth, we give one vaccines like a polio vaccine, BCG vaccine, hepatitis vaccine. For what? To prevent further complications, to prevent further diseases, which is a primary prevention, to stop the disease before it starts. Then hand washing is the main thing we prevent to attack different type of bacterias. That is prevention. Then the clinical features means sign and symptoms. Whenever disease occurs, how we diagnose diseases occurs according to their sign and symptoms. Then the diagnosis, identifying the disease. How we identify disease in the patient? In that, we see the patient behavior, patient sign and symptoms, patient's complications, how he react, how he shows their sign and symptoms about any diseases, that is diagnosing according to history collection. When your patient comes to the hospital, we take first of all history collection. In that, all the data and criteria we write down, and according to that we diagnose the disease. After that, management, the treatment plus nursing care. Above all points we covered, and in that we see how disease occurs, why disease occurs, then what are the complications we see, what are the risk factors, then what are the preventions, clinical features, and all these points combinedly at the end point, which is management, which is help to manage the treatment suitable, which treatment is more suitable to that patient, and then we give the treatment plus nursing care. Nursing care is the most important role to recover the patient from the any disease, and that is called management. So now, students, you understand the all the these 10 important medical terms. These are basic terms to understand any type of disease in our medical studies. So FNOs, that was a quick and high yield summary of these 10 diseases. Next videos we will apply these terms to real disease conditions like ophthalmia, neonatal, PIH, and many more. Don't forget to like, share, subscribe to our channel for future nursing officers with Aishwarya, for simple exam focused learning. So now we see you in next class. Thank you.